Welcome back to The Explainer. Today, we're tackling a big one, navigating the journey of pregnancy when you have diabetes. We're going to dive right into the key guidelines from the American Diabetes Association's latest standards of care. So if you have diabetes and you're thinking about growing your family, here's the thing. The journey to a healthy baby actually starts way, way before you're even expecting. You'll hear this a lot, but planning is everything. It's the foundation for this whole process. And this quote from the ADA, it just gets right to the heart of it. Yeah, the risks are real. There's no sugarcoating that. But, and this is a huge but, the fantastic news is that with some proactive care and a really solid plan, you can totally change the game for both you and your baby. So the crucial point right from the get-go is that the most important steps, they often happen before conception. Seriously. So let's break down what that pre-planning journey actually looks like. Okay, so before you even start trying, it really boils down to three big things. Number one, getting your blood sugar as stable and on target as possible. Number two, going through every single medication you take to make sure it's safe for pregnancy. And three, using effective birth control until you and your healthcare team give the green light. So what's the magic number? It's this one. The big goal is to get your A1C, that average of your blood sugar over a few months, below 6.5% before you conceive. Why so specific? Well, think about it. The baby's major organs are forming in those first 5 to 8 weeks, often before you even know you're pregnant. Keeping glucose levels tight during that tiny window makes a massive difference in reducing the risk of birth defects. And this is absolutely where you and your doctor need to be on the same team. You've got to stop some common meds, like certain blood pressure drugs and statins. Even some of the newer diabetes drugs, like semaglutide, need to be stopped at least 2 months ahead of time simply because they hang around in your system for a while. And at the same time, it's super important to start a prenatal vitamin with folic acid to support healthy development right from square one. Okay, so you've done the prep work, and now you're pregnant. The game changes a bit. Your management plan gets even more specific to support that growing baby. Let's take a look at what the new targets are. Wow, right? Just look at how tight these targets are. And there's a really good reason for that. We're essentially trying to mimic the glucose levels of a pregnant person without diabetes. The idea is to create the most stable, healthy environment possible for the baby to thrive. And it's not just about those minute-to-minute blood sugar checks. The big picture goal, that A1C, also gets tighter. The ideal is to get it below 6%. But it's a delicate balance, right? Because the absolute top priority is to avoid going too low, to avoid hypoglycemia. Now, it's really important to understand that how this is all managed depends on what kind of diabetes we're talking about. For gestational diabetes, the kind that shows up during pregnancy, it's all about lifestyle first. Diet, exercise, that's your first line of defense. But for pre-existing type 1 or type 2, insulin is really the go-to tool right from the start to hit those tight targets we just talked about. All right, let's shift gears and talk about a really important road sign to watch out for, and a key recommendation for preventing a pretty serious complication called preeclampsia. You've probably heard of preeclampsia. It's a major concern in any pregnancy, posing risks to both the parent and the baby. But here's the thing. If you have pre-existing diabetes, your risk of developing it is just higher. So, to get ahead of that risk, the guidelines are super clear. They recommend something surprisingly simple, taking a daily low-dose aspirin as a preventative measure for anyone with pre-existing type 1 or type 2. And the timing on this is crucial. You don't just start this on day one. There's a specific window for it to be most effective. This preventative step should kick in between 12 and 16 weeks of gestation. Okay, the baby's here, but the journey is far from over. In fact, the postpartum period brings some of the most dramatic changes of all. It's an incredibly important phase for your health. I mean, seriously, think about this. The second the placenta is delivered, it's like a switch flips in your body. All that insulin resistance that was there to help the baby grow, poof, it's gone. Your body's need for insulin changes almost in an instant. And to give you an idea of just how big that switch is, look at this number. Your need for insulin can plummet, not just from your pregnancy levels, but by an average of 34% compared to before you were even pregnant. That is huge. And it means you and your team have to be super careful to avoid dangerously low blood sugar. So if you had gestational diabetes, your care journey keeps going long after you've brought the baby home. First up, there's a specific glucose test between 4 and 12 weeks later to see where things have settled. But from there, it really becomes a lifelong thing. Screening for type 2 diabetes every 1 to 3 years is the recommendation. And here's exactly why that lifelong screening is so critical. Having GDM is basically a huge heads up for your future health. Just look at how that risk of developing type 2 diabetes climbs over the years. We're talking about a 50-50 chance within 40 years. Now, knowing this isn't meant to be scary, it's empowering. It gives you the chance to be proactive. When you look back at this whole journey, from planning before day one to lifelong care after delivery, what's the one big takeaway? It's partnership. A partnership with your healthcare team, with your family, and with yourself. It's about building a foundation for a lifetime of health. So, how will you start the conversation?